Hey everyone, I hope y'all are doing well and are having an amazing Friday. Today's webinar will be about MyChart. What exactly is MyChart? MyChart is an online website and mobile app that patients can use to easily manage their personal health information based on information given from medical experts such as doctors and physicians. Where is MyChart available? MyChart is accessible on any kind of device from anywhere in the world. MyChart currently has users in 2,551 cities in over 130 countries. In Canada, MyChart is accessible from over 50 health clinics in Toronto and Southwest Ontario, and a couple from other provinces. In the US, MyChart partners with health clinics in all 50 states. Who can access MyChart? Patients of participating hospitals may have access to MyChart, but they can electronically give access to caregivers, hospital clinicians, primary care physicians, and pharmacists. How do patients begin using MyChart? In order to register for MyChart, patients need a PIN. The PIN is a 4-digit number assigned by the support team. It is a one-time use registration number that must be validated before you can register with a username and password for your account. And do not share your PIN with anyone with the exception for registration purposes. To sign up for MyChart, go to the website www.mychart.ca for Canada or www.mychart.com for the US and press register. Then choose the organization, health clinic, you are registered with from the available options. Then you'll have to put in your patient information and health card number if applicable to receive your PIN. How do patients access MyChart? Once registration is complete and you have your PIN, you can access MyChart from anywhere at any time by logging into your account on the website or through the app. How does MyChart receive information? MyChart receives its information directly from your hospital or children's EPR, Enterprise Resource Planning, system and through self-entered information. Some test results might not be available until reviewed directly by a physician due to sensitivity and timing of patient's last visit. What do patients have access to through MyChart? Patients have access to their family health details, including allergies and medications. They have access to their appointment requests, patient questionnaires, upcoming appointments, post-appointment notes, radiology, such as CT scans, MRIs, X-rays, and ultrasounds, pathology, and test results. Can patients merge accounts? MyChart allows patients to pull all of your medical records together and view them in one place. They call this Happy Together. When you connect your accounts from participating organization, information from those organizations appears right in the app MyChart. How does MyChart keep your information confidential? MyChart is secured with the same encryption technologies used by major banks for online banking. How can patients pay their bills through MyChart? Once logged in, click on the Billing tab. Credit card payments can be made directly through MyChart to any hospitals or physician office accounts that you have with Premier Health. How do patients receive notifications? The MyChart app icon will appear in the upper left-hand corner of your device's home screen when you push Notifications are available. To see notifications, press the icon and slide it down. You may opt to turn the notifications on or off. How to download the MyChart app. The MyChart mobile app is currently available on the App Store in iOS and Google Play Store on Android. Search for MyChart in this search bar and select the app that has this icon over here, and you can download it for free. Alternative apps and sites. Capsule PHR. This organizes medical appointments, stores documents and test results, sets reminders for taking medications, records health data on graphs. My Medical. This app charts test results, sets medical appointment reminders, stores information about medications, allergies, diagnosis, and etc. The third app is MediSafe, which is a pill reminder app, and the last one is Flare Down, which helps patients track and visualize their illness, treatments, and symptom triggers.